The preferred method for determining the prescribed activity of spheres microspheres is the body surface area or BSA method. This method has been applied in clinical studies in which spheres microspheres have been used either alone or in combination with systemic chemotherapy. The BSA method adjusts the prescribed activity of microspheres to be implanted according to the size of the tumor within the liver and the size of the patient, with adjustments being made for the amount of liver-to-lung shunting in the particular patient. This method utilizes the patient's body surface area, the extent of tumor involvement of the liver, and the percentage of lung shunting. The patient's body surface area can be calculated from the patient's weight and height. The proportion of the liver that is replaced with tumor can be determined from the CT or MRI scan. This requires estimation of the volume of the tumor and the volume of the whole liver. The percentage of liver-to-lung shunting can be determined from the nuclear medicine study with technetium-99m labeled macroaggregated albumin. It requires the estimation of the amount of activity in the lung and liver from a planar or SPECT scan. The patient-specific prescribed activity can now be calculated and results in adding the two patient-specific components of BSA minus 0.2 and tumor involvement. The resulting prescribed activity of spheres microspheres needs to be reduced if the lung shunting fraction is 10% or more. If the patient has a liver-to-lung shunt of 10 to 15%, then the prescribed activity must be reduced by 20%. A shunt of 15 to 20% requires the prescribed activity to be reduced by 40%. Liver-to-lung shunt of more than 20% is a contraindication, and the patient must not be treated. In patients with underlying liver disease or impaired liver function, a reduction in prescribed activity of approximately 25% should be considered. The treating interventional radiologist and the prescriber should review the prescribed activity calculations as a team.